High-touch surfaces like doorknobs and elevator buttons are how we interact with the world and the people who have touched them before us. Would you be satisfied if your sunscreen only lasted for 15 minutes? Probably not. So why are we satisfied when our disinfectants only give us 15 minutes worth of protection from the transmission of deadly pathogens? High-touch surfaces account for a significant portion of hospital-acquired infections that kill more people than breast cancer and prostate cancer combined each year. The WHO has estimated that by 2050, 10 million people will die a year of drug-resistant pathogens. And I don't have time to talk about foodborne pathogens and food safety. Hi, I'm Ted Eveleth, the CEO of Halomine. I'm a serial entrepreneur with 30 years of experience growing startup companies. About 2 years ago, I ran across a group that was developing antimicrobial coatings that I thought could change the way we think about disinfectants. The way that we disinfect hasn't changed for over 100 years, but my co-founder, Dr. Chow, invented a new product that modernizes the way we disinfect, and we do that by making a good thing better. Chlorine has long been known as an effective biocide. We use it in our drinking water, in our pools, in our laundry, and in our cleaners. The only drawback of chlorine is that it doesn't last on a surface for very long. So Halomine's first product, HaloFilm, allows you to take the same level of chlorine that you'd find in a pool and put it on almost any surface for as long as a month. That means HaloFilm treated surfaces are as safe to touch as water in a swimming pool, but are deadly to pathogens. Bacteria that land on HaloFilm treated surfaces are killed in under 10 minutes, and mold is deterred for as long as 30 days. How does it work? Well, simply, HaloFilm sprayed on the surface before a chlorine-containing cleaning product holds onto the chlorine at just the right concentrations to be deadly to microbes and safe for us. HaloFilm creates a transparent film on surfaces that act like glue for chlorine. It adds a mere 30 seconds to your cleaning regimen, but 30 days of protection. You can maintain the chlorine with repeated application of disinfectant, but HaloFilm does not build up, so you will never exceed safe limits of chlorine on that surface. And it provides protection that you can see. So in the same way that you test for chlorine in a pool, you can test for chlorine on your surface. So when we started talking to customers, they were concerned about C. diff, which is a bacteria. They're also concerned about Candida auris, which is a fungus that's resistant to the 3 classes of antifungal drugs. Now, Candida auris has a 50% mortality rate in 90 days. So you can imagine we are in the global fight against infectious disease, and we have a number of pathogens that are developing resistance. So the problem is only going to get worse as these resistant pathogens develop and grow. So we need to have better protection as we lose the benefit of antibiotics. We're running out of our best defense, so we need to come up with some new ones. Halomine is developing antimicrobial products that provide long-term protection against a variety of pathogens. We're looking for a world where your disinfectants last longer than your deodorants. We hope you'll join us.
What a great and timely product, as I think disease transmission is something that's on the top of all of our minds lately. We're joined now by CEO of Halomine, Ted Eveleth. Hi, Ted. So I think that there are many different potential applications that we could see for something like HaloFilm. Could you talk about what the first application is that you see for something like HaloFilm going forward? And I also believe you might need to unmute yourself.
We segment the market into 4 areas: food, institutional, health, and consumer. Now, each segment has different pathogens of interest and different value propositions. The first initial target for sustained sales and marketing effort are food and institutional. And by institutional, I mean mass transit, schools, cruise ships, or office buildings. And we're targeting food because of food safety and the product loss due to mold, and institutional mainly because of heightened concerns around COVID-19, but we try not to emphasize any applications that are pandemic specific because someday, hopefully, this will all pass. Now, our biggest market, health, and hospitals where we hope to reduce hospital-acquired infections will be a later market for us because we have to acquire more data on efficacy for a longer list of pathogens.
And what is the timeline for release of HaloFilm with this application?
So we've already sampled a number of potential customers and strategic partners. We anticipate early next year to have product for a regional rollout, during which we'll establish some initial sales, do some pilot studies and white papers, confirm some key customers, and acquire purchase orders before we do a national launch towards the middle of next year.
And in terms of your first customer, do you have any insights into who that may be?
Well, so two prototypical customers might be IndieBio, who performs contract cleaning services for kitchens in the Chipotle and McDonald's franchisees, and Janitronics, who provides janitorial services to New York State government buildings. Now we're targeting service providers because with one customer for us, we can reach hundreds of end users.
I see. How have regulatory restrictions or guidelines guided your path to market with HaloFilm?
Well, part of the reason for the regional rollout is the need to register the product with 10 states that regulate our type of project, which is an adjuvant. Now, we're not regulated at the federal level because we're not a disinfectant per se. We just make a disinfectant last longer. We'd also like to add food contact surface approval to our list of available uses before national rollout. We've been working over the last year with a great regulatory consulting firm, TSG Consulting, and we're comfortable with where we are and the timeline that I put out. Now, I should also add that we are now one of 5 products that have ever passed the existing residual self-sanitizer test, and believe we will be the only product that can pass the newly published residual antimicrobial coating product testing protocol. So regulation really kind of cuts both ways.
Yeah, well, congratulations on that major milestone of the RSS, passing the RSS test. Well, thank you so much, Ted, for answering these questions today and taking the time.